Welcome to another episode of United for a Healthy Stoughton. My name is Stephanie Patton, and I am the Prevention Coordinator for the town of Stoughton. And I am delighted to welcome Dr. Joseph Baeta here, the Superintendent of the Stoughton Public Schools, to have a conversation with me today. So welcome.
Thank you.
Yeah.
Great to be here.
Yeah, fantastic. So I would love if you would tell our home audience a little bit about yourself, and I'm going to ask you to share a fun fact somewhere in there.
I was born in the Azores, immigrant to Stoughton, been in Stoughton my entire life except when I went off to college. Been involved in Stoughton for a long time, specifically town meeting rep, school committee at one point. Been in education for 32 years, teacher, coach, advisor, mentor, assistant principal, superintendent, this is my 15th year as superintendent. At one time I was the youngest, or one of the youngest. Now I'm actually on the other side of it. And we live in Stoughton. I'm also continuing to live in Stoughton since with my wife and my daughter, and my parents are still here, so very connected to the community, very involved in the Portuguese American community at some of the social clubs and so on and so forth.
Yep. Fantastic. All right, so tell us, what's your fun fact?
I don't know if I have a fun fact, but I'm the thing that makes me have fun is anything to do with volunteering. I'm into that.
Yep.
So I actually help to run the Our Lady of Fatima feast in town. I'm involved with the other feasts in town. It keeps me culturally connected.
Yep.
And I don't know if it's a fun fact, but it's what makes me not feel stressed and relaxed. And my daughter participates, my wife, my daughter especially. So it's bonding time, it's family time. So that's the fun fact.
Okay, I like it. Giving back to your community is a really important self-care thing too. It's really great for the community. It's good for you. It's a good way to channel your passion. Awesome. So I'm going to ask you to tell us a little more detail about your career history and how you ended up here back in Stoughton as the superintendent, and what draw you to want to be a superintendent, when you started that path.
Yeah, so I spent almost 11 years in the classroom and then dabbled in administration at my first administrative job was at Tri-County Regional in Franklin as the academic director overseeing the academic programs. I had a counter who oversaw the vocational programs. Then I became the director of curriculum there for 2 years, so I was working with both sides of the house. And then I went to Holbrook, Mass, an underperforming junior-senior high school, looking for a change agent, and brought some of that 6 years of experience there, and we began the turnaround.
Yep. And now they have a new building, right?
That design took 3 years to come to fruition, and as I was leaving, they were going to the ballot box. So that design of one building district, K to 5 with a 6 to 12, absolutely gorgeous, state of the art, one of the first in the Commonwealth. The idea actually came from another state. And there was a lot of pushback originally because of the size, and it's a small district, so why aren't you regionalizing? So we had to go through that entire process.
Yeah.
And then I was there for 9 months when my superintendent at the time announced that she was leaving. So I went for the interim job and started July 1, and in November was named the permanent superintendent. Did that for 4 years and then moved for the last 10 years to Norton, Mass, where I had a great experience in a great community, great staff, outstanding colleagues to work with. Struggled with money in terms of the finances, but that's just a given in some communities.
Right.
But had a great run. We did a lot and also got to really grow into the job. And then Stoughton had been through some challenges and changes, and I had a discussion with some of the folks on the school committee and wasn't looking to leave, and I think just once a night, always a night kind of drew me back.
Yeah.
Thanks to them and taking the chance on me, we've come back and are dealing with the challenges before us, but it's been a great experience. A lot of great things going on, a lot of opportunities as well. I prefer to call them opportunities than challenges. And then lastly, really just trying to create relationships between labor and management, within the community, town hall. And Stoughton is a very political community, as we all know. I can say that, I think, because I also reside here.
Yep.
But I think everybody's trying to do the right things, just sometimes we see it from a different lens.
Agree. Yeah. Yep. Absolutely. I think sometimes when we think about communities that have a lot of passion, I think sometimes that comes out in disagreement or conflict. But you're right. I think, but people have such deep heart for the community that it's really all coming from a good place.
Yeah, I agree. I think the world today is in such a different place with the politics of social media and which cable station you listen to and all of that stuff.
Right.
And I think that's an important part of where we are right now. And I think Stoughton is just one part of that. Right? We see the world from a different lens. Doesn't mean that we can't find a way. We would hope that DC did that more often. At the end of the day, after all the stuff that happens, Stoughton comes together and does what it needs to do.
Agree.
So that to me is the reason why it's a great community.
Yeah, people really do care about each other and take care of each other when things are hard. And you definitely see that. Yep. So can you tell us a little bit about your vision for the Stoughton Public Schools and the things you're excited about and the possibilities?
Sure. Yeah. So I've always looked at the concept of creating the vision as more about us and not me, right? I've always led from the perspective of the team and bringing in different views and perspectives. When we did the SWOT analysis with the leadership team, strengths, weaknesses, opportunities, and threats.
I was about to ask you to say that for the people at home,
What we did is we looked at what were our strengths, and we had a laundry list of things. And then what are our weaknesses, another list, and then our opportunities and our threats. And threats are typically politics and money. That's typically the two that stands out. Opportunities is where, if you really want to make change and move forward, that's what you should concentrate on. Continue to do what's well. Concentrate on the areas where you see that opening and you can say, let's go after it. And creating the relationships is one of them. I think the other one is really trying to, within the sense of creating relationships, just having honest dialogue. Let's agree to disagree, but let's be able to have a cup of coffee afterwards. Our opportunities right now is we're a growing community, and that's very difficult for people to understand because almost everybody else is actually declining. Without getting into a lot of details about, for example, the migrant situation that we have in town, which is a real issue of 90 students that we really didn't expect and so on and so forth, we still have these 3,700 students that just 2 years ago we had declining enrollment, and now for the last 2 years and for the next 10 years, we have projected increased enrollment.
Wow.
If, in fact, we continue to grow at the level that we're growing, we have some capacity issues that are an opportunity and also an area that we really have to keep an eye on.
Right. Absolutely. So I wonder, does that lead to some of the conversations about like buildings, and the South School project is something that you all been talking a lot about?
The South School project is an opportunity for Stoughton for a number of different reasons. Number one, we haven't built an elementary school, as we know, in decades. Number two, we are a growing community. Number three, MSBA is giving us more money than was anticipated when we originally went out. But more importantly is it's 2024 and none of our elementary buildings are in the 21st century. Right? And we really need to think about what that means. Here we are in a beautiful studio, right? And we have one at the high school as well. These are the types of things that kids are into. STEM, science, technology, engineering, and mathematics is where kids are interested, even at the younger ages. So that building shift also allows for us to support the growing issues that we have. And so we put together a subcommittee to take a look at our facilities. What are we really going to do with the South if in fact this project goes through? What are we going to do with the Jones? What are we going to do with the Wilkins? And what does that mean? There's also a lot of discussion around the state really supporting universal pre-K. And so where does that happen? Our preschool numbers are approaching 150 students and growing. So we are running out of capacity at the current Jones School. So some of the thoughts are to shift those, and I don't want to speak about where it's going to happen, but there's a lot of ideas that make sense. We're going to let a working group make a recommendation to the school committee, and then the school committee make that decision as the governing body.
It's exciting, though, to think about the possibilities, right?
Yeah, it is, and it's taken a lot of work, and if you haven't gone onto the Stoughton website for Stoughton Schools, stoughtonschools.org, go on there, go onto the building page, and you can find a ton of information. Right now we have an opportunity to utilize actually looking at what the inside of the building would look like, and so on and so forth. So please take a look at at doing that, because your input is important, especially as we go for a vote, and if it's successful, it becomes final. This is what it's going to look like.
Right. Yeah. Actually, right before you came in, one of the screens here in the studio was airing, I think, that sort of virtual walkthrough of the space. It was pretty cool to see how the technology can help people to imagine what that might look and feel like.
And I think that's the thing is that the not only the technology, the increase in safety and security and opportunity for kids. I mean, that's the sense of building a new school.
Yeah.
Is all of those put together, leading to, in our case, an educational plan that really is looking to provide students that next level of opportunity, which also leads to our discussion that internally we have to do other things at the elementary schools, the other elementary schools, in order to keep it equitable for our experience at the elementary level.
Right.
More than likely, as many know, the long term is not to build a new elementary school, it's actually renovation and consolidation of at least two of our elementary schools, which would be the Dar and the Gibbons, because they're actual models built on the same idea. They practically look alike.
Yeah. Those are the twin. Those schools are basically twins. Yeah.
And so the idea is to do that, and of course, there's also the middle school. That's even before that. That's a priority as well.
Yep. Excellent. So let's talk a little bit about sort of the whole student idea and places where the work that I'm doing around prevention and health and wellness, and the work that the district does around that, like some of the intersection. And I know you've been involved over the years with lots of really interesting statewide initiatives. I keep finding your names on papers with things related to vaping prevention and other kinds of things. So let's talk about some of that stuff.
Sure. I think that the whole concept of the whole child is something we actually got away from in a long time, especially with MCAS came along.
Yeah.
You know, we went to this one school perspective. We dropped the arts. We dropped physical education. We changed our schedules into remediation math, remediation ELA. And I think what we've learned from almost 25 years of that in the last 5 years, especially coming out of COVID, is yes, an assessment is important. I'm not anti get rid of the test. I'm just saying that we need to go back to some of the basics of the way we do things. And one of them is the mental health of our children and the substance abuse that we know we see in homes with adult populations, but we also see with students. The social, emotional, the mental health capacity of kids coming out of COVID. I was just having a meeting before this with some of our parent leaders talking about the isolation period that we went through. And it really has it's hurt all demographics, from our elderly who were living by themselves. You know, I can remember visiting my parents in the driveway, all early on, to being so scared of losing someone because they do have a medical issue, but also as a parent of a single child, knowing how much my spouse and I had to do to keep our daughter engaged, because there weren't friends getting together on the regular basis, especially from that March until the fall. That was a really difficult time period for a lot of kids, which led to parents working from home, which led to parents having to make difficult choices about what do I do with my kid. And so, you had some schooling going on in terms of the hybrid models, or before that, the total virtual model, but you had a lot of screen time with other things as well. You couldn't go, quote, across the street to go play. In most instances, some families did, but most people didn't for their own decision. So I think that's led to a lot of that. And vaping, I jokingly say, all of a sudden there was no vaping in my high school. Well, that's because I only had half the kids in at one point.
There weren't a lot of students.
There weren't a lot of students there. Vaping was, and I got involved with that through a grant working statewide, and just trying to give school systems. It was a working group of folks, about two different groups of about 10, 15, an advisory group and a working curriculum group. And the idea behind that was to vet some resources. I Decide came out of that. And just say to people, hey, there's some stuff that costs you, and there's some stuff that's free. But we also learned a lot from the kids and the students and what they were saying to us about, we learned from smoking that just suspending kids because they were smoking in the bathroom back in the 70s, 80s, and 90s wasn't going to work. And it didn't work. More time away to just smoke by yourself at home. Now we have vapes. They have all kinds of chemicals in them. Just kicking kids out of school is also not where we are as a community, but the balancing act of that is we know plenty of kids who don't use the bathroom during the day because they don't want to be caught
Right.
in a situation.
Yep.
So it's a catch-22 a little bit about when do you suspend a student, when do you try to send them down a different road, are they ready for it? When I met with students during that time period when we were creating that, I met with my high school students, and I actually had a student in the room who was a vapor. And what he said to me is, I know I'm going to be ready at some point, but I'm not ready right now. That was kind of an interesting notation. But then it became later on, I'm ready to quit. And the psychology of that for him was so difficult. And it took forever for him to really feel like, who can I trust? Who can I talk to? What do I need to do? It's an addiction.
Absolutely. And it's a tough addiction. Those nicotine salts in those vaping products.
One of the things that we've seen work through the years is really having a conversation with students about, that big business is very much involved with this. And what does that mean to you? Does it mean anything to you? Just saying, no, don't do it. I mean, you can't sit at a bar today without seeing somebody doing this across from you. It's crazy. So that's adults. So the addiction is real. When it comes to the mental health, the social emotional, in my last district, it was a union, school committee, superintendent, united front that we were seeing mental health at a level that we thought needed to be dealt with in some way. And so we were just banging away at it, trying to come up with different approaches within the curriculum, implementation of SEL into the curriculum, making sure that we were checking in on kids. Are you ready to learn today? If why not? Do they need to see a counselor because they're not ready to learn? We'd rather do the proactive than the reactive. Let's wait for them to get to 10. They get kicked out of the class as a fifth grader. We don't want that. So. That's been the approach that we've had, and I think Stoughton has tremendous support systems. We also need to continue to grow our wraparound services that allow for kids to see, or families to see third parties, not just us as the provider for basically 180 days. There's still another 180 days left.
We see them.
We're open for 7 hours a day. There's still hours left in the day, and there's weekends, and there's all those other Monday through Fridays we don't see.
And they live in the community.
Exactly.
I think it's interesting. I was at a training yesterday with Dr. Randy Schuster, who I know you know very well through your work with the vaping stuff. And she was talking about how, sort of like it or not, schools have kind of become the front lines for primary mental health prevention because during those 180 days, that's where kids are, and sometimes that's where the behaviors might emerge for the first time. And or, we're in this pattern where you might be the first people to see things. Well,
one of the things it's really interesting. It's not going to happen, I don't think, during my time, but I think in the next 10 to 20 years, you're going to see schools being open until 8 and 9 o'clock at night just for supporting mental health. So you take a look at your mini clinic perspective, and you're seeing schools as that mini clinic for students through insurance, through counselors that are available for kids and so on. I really think that's where we're headed because first and foremost, at least around here, we're closing hospitals, not opening hospitals.
I know.
We're spending a lot of time in ERs with things that probably belong at a doctor's office with a primary care. The insurance issue is a problem. So schools become the network for at least 180 days where some of that is available.
You become the hub.
You become the hub. And so I think that down the road, and again, I'm not suggesting this for tomorrow. I got plenty of other headaches, but I do think that the school's hub is going to be that, like Dr. Schuster says, that we're going to be the ones that are open, not only for basketball at 5 o'clock, but for going down to the clinic and having a one-to-one, mental health counseling session with a specialist.
Well, and for some kids, the school might be the place where they have their only trusted adult in their life, and we know how valuable those relationships are. And we were talking about the vaping issues and some of the other substance use issues at this training, but a lot of it really comes down to relationships and kids being able to have that safe place where they can talk to somebody, and when they're struggling or they're in trouble, that it's just like a little bit over time, we're just building those opportunities for kids to have the space to say, like, I need help, and then being able to hopefully triage them.
The best of teaching and learning, I've been saying for a long time, is relationships. A trusted adult who can provide a student of any age an opportunity to get better, to feel better, to be positive, to support each other, if you will. Kids are kind. You know, they're
Yeah.
not. They don't. You know, kids are kind. I mean,
Yep.
the whole idea that kids are bad and all that they're not. I mean, somebody who's going through a struggle of mental health doesn't make them a bad person.
Right.
It's a little bit taboo, as we know in the industry, that to talk about mental health as if we're talking about alcoholism or drug addiction. It still has that X on it in many ways, and it's also very private, right? Families don't necessarily want to bring out
Right.
to a community event or situation.
Right.
So it's a very private thing through the years that I've been involved of asking families to be more involved and them worried about who else is going to see me walk into that
Right.
versus the doctor's office is in another community. I may not even see anyone
Right.
when I walk into that building.
Right.
So
Yeah, I think for some families that separation is important to them,
Yep.
and and I think at the same time we were talking about sort of the whole child being able to work with the kid that's in front of you. Sometimes the kid in front of you is struggling with, it could be a medical issue, it could be a mental health issue, it could be a learning challenge.
Yep.
Like there's lots of things that kids bring with them. But I want to circle back to the thing you said about kids being just fundamentally like good,
Yep.
kind. I think it's something we sometimes forget, especially when we think about teenagers and the sort of the prevailing narrative about teens and tweens and
when I met with I have two student advisory groups,
Yeah.
one for the middle school, one for the high school. And at the high school, we got to talk about the handbook a little bit.
Yeah,
And I reminded them that handbook is for 5% of the total population in the building.
right.
It's 60 pages long for 5%.
Yep.
95%, yeah, okay, you're late to school, you get a detention. Yeah, you didn't, whatever. But the real hard part of a student handbook is for 5% of the population.
Right.
It's for the same, and those kids actually, I think, need us to be more supportive and to come up with different ways. Reading and writing is not for everyone. Yes, we want to make sure we get them to a certain level. We want them to graduate with a diploma. You don't have to go to college to be successful in life.
Right.
Is that the American dream in many ways? Probably. The American dream is also owning a good business and not going to college.
Right. Being able to take care of your family. Right.
Take care, support, being able to give back to your community through your volunteerism or through your checkbook.
Right.
Or both. When students don't go to, want to go to certain high schools and can't get in, and they end up at Stoughton High School, we have to continue to say to ourselves, how are we going to meet the needs of this student population? With having high standards, one of the things vocational schools did a long time ago when I was working there is that they really became the college preparatory high school. Now 60-70% of those kids go to college.
Yeah.
4-year colleges even. So, but at the same time, what that's done is it's hurt some of the traditional trades like plumbing,
Right.
like auto shop,
Yep.
auto body, auto tech. Those traditional shops have seen not necessarily the same number of kids wanting to go into the field. Try hiring a good plumber today. There just aren't enough out there, and they make a good living.
They do. Yeah.
Or electrician, and et cetera. The
Right.
trades are the trades. They're doing
Yep.
really well.
Yep.
But they're also having a hard time finding people to work.
Yeah. Yep.
So kids fundamentally are good, and I'm never
Agree,
gonna
yeah.
I'm never gonna lose that because yes, we hear about all these negative things that happen at schools with the unfortunate situations. Those are still rare. They're less rare than they used to be, for the record.
Yeah.
But the fact is that the mental health is real. There's aha situations in almost every single one of those cases, and we're learning from them. But at the same time, we're trying to be as proactive as we can. But as I say to parents and family members and everybody else, there's no guarantee.
Right.
There's no guarantee. My number one job is the safety and security of these buildings and the staff and the children that are in it.
Yep.
And I can't guarantee you that. I can only work every day to try to make it better.
Yeah, and just do the best you can. And-
Exactly.
Yep. Well, and we're all sort of in that together. That I think all of the things we've been talking about are complicated issues. They require complicated solutions, right?
Well, and I think kudos to you, to the town, for recognizing that having your organization and really like taking it on and supporting it Because I didn't have that in my last district, right? And I know many districts around us that don't have that.
Right.
And I know it costs money, and when things get tough fiscally and all that, you have to worry about it. But one of the things we really have tried to do with you folks is open our doors to you and say,
which I
please
appreciate.
work with our staff, please work with our students, and provide the resources because they're limited, number one, but number two, there aren't towns that have the Oasis group. There aren't towns that have a youth commission.
Right.
We have both.
I know. It's amazing.
It's amazing. It's
Yeah.
amazing. And I think one of the things I continuously have been saying is we need to add more of that, not less of it.
Right.
And we need to have our students know that it's available to them through their parents, of course. Right. We want parental involvement through the law, but we need to continuously, as a school district, take hold of those things and work with them, and have our doors open to it.
Right, right. Well, and I think it goes back to the piece around 180 days of the year, right?
That's right.
That you have them kind of there, and for prevention efforts, like that helps also because it's a captive audience when we're thinking about prevention. Substance misuse is an adolescent issue. It starts in adolescence, almost all of the time. Like people who go on to have challenges, like it's happening then. And it's so intertwined with the mental health stuff. And, we really were talking a lot yesterday about sort of those core reasons why kids might turn to alcohol or to vaping or to marijuana, and the products are so different now, than they used to be. And they're so concealable, and it's, and yet most kids are making really good choices when it comes to their health and safety.
Again, most kids are doing the right thing all the time.
Right.
Kids are always going to make a mistake.
Yep.
You hope that mistake becomes a learning mistake, and that's all it is. And we've all done it. I've done it.
Yep.
But you learn from it. But there are those situations where, for whatever reason, there's a laundry list, as you know better than I do from your expertise. A kid goes down the wrong avenue, and our job is to put as many stopgaps as we can, and hopefully divert them in a way that they have their aha moment, and are able to deal with it. Right.
Well, and kids, just like adults, do things because they are working for them, even if it's not. Maybe it's maladaptive. It might be, as adults, we might look at that and go, yep, using marijuana to manage your mental health, not really the best pathway. However, in the short term, that kid is finding it's working as a solution. So I think you're right. It's creating those opportunities to work with kids, and it doesn't make them a bad person, like any of us. Like just doing something that, maybe isn't the best choice for your own health or your own safety doesn't mean that you're a terrible human. Or,
correct. Yep.
We all
couldn't agree
mistakes. More. Yeah. So our time is just about up. So I want to ask you if there's anything else you want to add or say to folks at home. I really appreciate you being here.
Well, thank you for the opportunity. This is great. But I want to go back to the last comment I just made.
Yeah.
I think that the opportunities of having an organization like you work within the community is what makes Stoughton that real community. So thank you.
Oh, well, thank you very much. What a great ending. I love it. Thank you so much.